Today on this episode of The Brain Surgeon's Take, we will be discussing how I beat a brain tumor with Venezuelan TV star Erika De La Vega. Get a unique patient perspective on what it's like to battle a brain tumor, as well as the physical and psychological toll of such a life-threatening diagnosis. Much more on this podcast episode. Welcome back, everyone. Here's my take on Erika De La Vega. She is an internationally recognized TV star who is the face of Venezuelan entertainment. But more importantly, she is a courageous individual who does not back down from life's challenges. Being diagnosed with a brain tumor and undergoing surgery are clearly life-altering events that require grit and mental toughness. Erika not only underwent brain surgery without flinching, she actually came out of the experience stronger and with a better life perspective. As Erika's surgeon, this interview really hit home for me. Brain surgery is something I do multiple times every day, roughly 800 times per year, so it's normal over time to trivialize their magnitude. However, speaking with Erika quickly reminded me that a regular workday for me is a life-changing event for multiple patients and their families. There is no doubt neurosurgery is the best job on the planet, mainly because of the significant impact we get to make on a routine basis. I admire Erika and all of my patients for being so brave and trusting us with your lives. Being a neurosurgeon is a privilege, and I'm honored to be your doctor. Listen up as we discuss how I beat a brain tumor. Check it out. Hey, Erika, how you doing?
Well, great. Speaking with you, talking with you, like it's a great way to start the day.
Well, I appreciate that, Erika. I've told everyone you're like my poster child for brain surgery, so I just wanted to talk about your experience, educate our listeners as to what you went through, how you did so well, and what you've learned from the experience. So I guess take us back. How did you first find out that you had a brain tumor?
Well, first of all, Rick, I have to say to your listeners that my language is Spanish and I'm going to do my best to speak the proper English to so can people understand. So it was very weird because I was looking for aneurysms because my mom had exploded an aneurysm 4 years ago. So the doctor that did the procedure told us, my sister and me, that we have to have an MRI to see if we have an aneurysm. And okay, like, when somebody tells you something and yeah, someday I will do that. So the thing is that I torn my ACL skiing in March of last year. So I went to the doctor because I need the referral for the insurance and the system. And I told her like, hey, now that I'm here, send me to do an MRI to see if I have this aneurysm because 4 years ago this happens, and she told me yes, you have to do this test. So still, I wait for 4 more months, and because I have my knee broken, I can't travel. I was here in Miami, and like I have time to take care of my health. So I booked the first scan. That it was an MRI, and I remember that the technician told me like, if you don't move, I will take you here. I will take you out of here in 10 minutes. And I told him like, no, it's okay. I'm not claustrophobic. I can be here the 25 minutes. Like, I'm not in a hurry. I was the last of that evening, of that afternoon. He still did it in 10 minutes. So days after that, my doctor called me and she told me like, hey, um, something happened because I can see, we can see like two spots, but the radiologist doesn't know what it is. So you have to do a new test. We have you have to do a CT scan. And I was like, this is the technician that he told me that in 10 minutes I was out of here, and the test isn't like, you can look at it. Well, good, because he was in a hurry. That was my you know my thinking. So Weeks after that, I did the CT scan, and my doctor called me. I was in an airplane, like between Houston and New York, and she wrote a message like, "Can I talk to you?" Like, no, I'm in an airplane, but I need you to. If I'm not gonna die because of something in my head, I'm gonna die of a heart attack. Because every time you write a message, a little bit of humor here, Rick. Every time you write me a message, I panic. So okay, let me tell you, you don't have aneurysms. That's in that way you are all good, but you have a mass. And I was like, what? What is a mass? Like, I don't know what you're telling, why you're talking to me. And she told me, yes, you have a mass, and it's 3 centimeters, and we have to get an appointment with a specialist. And then, well, I paid internet in the flight, to see what is a mass in my head. So I like copy paste what she wrote to me and put it in Google, and everything that I read was tumor, 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 tumor. And I can't believe this. I don't even have a symptoms. I don't have headaches. I don't have, I can see, I can listen, all my functions are perfect. How come this is happening to me? So then I did another one, an MRI with contrast, and because I'm an expert now. No, I'm not. You saw it, and my doctor saw it, and it was a meningioma. And then I went to your office, and it wasn't funny, but we laugh about this because I went with my best friend, because I didn't want that my family, my mother, my sister, like go with me, because I don't want them nervous, or like I wanna listen to the doctors and see how I filter the information. So I went with my best friend that she loved medicine, and she told me, I'm coming with you, and I'm gonna ask all the questions that you never do. So it was funny because you came into the office. You sat down, and you told us like, hey, listen, you need surgery. We have to get out this meningioma. And you explained that the meningiomas, they grow very little year by year. Maybe you have this like a period of a time of 10 years. You said something like that. And my friend like, okay, perfect, doctor. Which are the other options that we have? And you like turn it like to her, and you say like, there's no options. This is the only one. And like, it was shocking, of course, but I took it. I t- I understand that I have to do this, and I was like very executive. Like, okay, when do we have to do this? Like right away. And my question was, why do we have to do it so quickly if it's not an emergency? And you told me, and my doctor told me like, you're gonna, the better, the sooner the better, because you're gonna get crazy thinking about things. And it was true. You told me to have surgery the next week, and I told you, no, I have some presentation I have to do. I have to travel. There's some tickets that people have in their hands. I don't want to like return the tickets. Let me go to Canada and return. And in 3 weeks, we were in well, having the surgery.
Well, so let me ask you a question. And we talked about this previously, but finding the right doctor, right? You have, since your experience, you have educated your listeners, your followers, your friends and family about how to find the right specialist.
Yeah.
Tell us how you found the doctor, and what should other patients do if they're confronted with a similar diagnosis?
Well, I think I had some luck, Rick, because my doctor, Alexandra Calandrielo, she told me like, you have to go with this doctor. This is the best doctor in town. I would never put my brain in hands of anybody that it's that Dr. Komotar. And that I was lucky, really, because then I went to see you immediately, and they gave me like something like this, like this, where like this is the information of the doctor. And when I started when I started to read it, like, wow, it was amazing, your curriculum and all the surgeries that you do yearly and all your experience. And like I didn't doubt about it. Like, if my doctor is telling me that this is the one, and then I read your recommendation, I Google you, of course, and I started to follow you on Instagram, like the media, how do you say, las redes sociales,
Uh-huh. Yeah. Social media.
the social media. Like, sorry, it's so, the words are so simple, and I just forgot. I I use a hashtag because I don't want to Google everything, because I had my prior I had my knee surgery on July, and Rick, that I ask too much questions, and I went to a lot of doctors, and I was very confused about what to do with my knee. So sometimes when you ask a lot, and when you go to different doctors and you listen to different opinions and you listen to the different stories of everyone, of the story, no, because I was skiing, no, because that happened to me, no, because I got surgery 5 years ago, and I went crazy. Like, really, that didn't help me like I thought it would. And you know what? With the doctor that I choose for my knee, it was the first one that I saw because of his curriculum. So now with this experience, talking about my brain, you know, um, I I have another approach. Like, I'm not asking a lot of people about this. I'm gonna keep it private, and I'm gonna talk to doctors, 2 or 3 doctors, so I can have an opinion. And you know what? Another thing that I did, I spoke, of course, with my doctor, Dr. Calandrielo. I spoke with you, and then I call a Venezuelan neurologist, um, Luzgarten. His last name is Luzgarten. He doesn't work here in the United States, but he do the same procedures that you do. And I call him and I ask him, like, please, in Spanish, tell me what is a meningioma, what is this surgery, what are the things that I have to do, how do I have to prepare. And he know you, and he told me, like, you are in the best hands. So for me, that was it. Like, you were very well recommended, and I like stick with the recommendations and with your curriculum, and I stay with it because I didn't want to see another one. People told me, like, you don't want to see another doctor, you don't want to go and have another appointment. I know this doctor that did the surgery for, I don't know, my parents. And it started like a bossing, like, you need another opinion. And I was like, no, I feel great. I'm sure that this is the doctor, and I'm gonna go with him. And that was it, Rick. But I was lucky. I was lucky. And I think you have to choose, like, what what approach you're gonna have, because you can go crazy nuts having the opinions of everybody.
Hmm.
When I publish my a post about my surgery 1 week after the surgery, that I told the people, my followers, that, hey, this happened to me. I'm at home, everything goes well. Like, people were like, why didn't you tell me? Like, I didn't know what you're going through. Like, because I didn't want it to. I needed to be very private, because I didn't want to go crazy. And you
Yeah.
can go crazy.
I mean, I think the emotional component is something that people don't. really focus on enough. They think of the physical, craniotomy, all that stuff. Let's talk about your emotions from the time you decided to have surgery to the day of surgery. How did you prepare mentally, and take us through your mindset on the day of surgery?
Um, Rick, I have been doing a podcast called In Self Defense, and for 5 years now. And in this podcast, I reinvent myself, my point of view of life. So I feel that these 5 years, my past 5 years, prepare me to this situation in my life. And I have different tools. I meditate. I have doctors that are friend of mine. And I call a friend that she's an expert in something that I don't know the name in English, that the name is psiconeuroimmunología. She's a doctor, but her approach in her investigations is that what you think and your relationship with life, with your nervous system, and everything is one. So you have to care about what you think about life, your relationship with life, with your work, with your friends, with your family, and your health. Everything is connected. So I called her, and she come, like, she told me, like, everything's gonna be okay. If you have to take it out, you have to take it out. Like, I didn't have doubt of that. Like, is what I have to do to have more years of life? Like, this is what I was very, I have courage with that. Like, I'm gonna do this, and I didn't have doubt. And she, like, talked to me, and she said, like, let's do a meditation, and let's send your tumor, like, the best vibes, and let's do an exercise, an imagination exercise, to like your, how do you say, the sistema inmunológico?
The immune system.
Thank you. So your immune system, like, be in the right place so you can recover quickly. And and your tumor, we don't have time to work in the tumor to put it, like, to have him in a smaller size, because we have only 3 weeks. But I think this is going to help you. And I started to do this exercise that is an exercise that everybody can do. You can have this, it's like a visualization, like having, or like, imagine, or all the cells of your body, like, working for you, in a positive way. And I did that, and it calmed me. And also, Rick, hmm, I trust, like, I trust life, because something, it's nothing is listen, it's not a tool that I can tell people, like, do this, because it's something that you can touch or see. It's something that you trust, in something that you, there is, like, some order in life. And I I said to myself, like, is if we've found this tumor, is because I have to be here. Like, this is gonna be okay. I'm in the best hands, and I'm gonna be okay. And I can, like, I didn't cry. I didn't get too much nervous, because I can't. I have to be very, very strong with myself, because I have people around me, I have my family. But when you are, like, in this cold place before surgery, we are with yourself, and you have to be your best companion. So I think that the work is internal, that I have to be good with myself. I have to be a good partner with me. And that's, I work on that. Like, I'm nervous, but I'm here strong. I'm with me, and this is gonna be all right. I Of course, I pray. I thought about my son. Of course, I have a lot of questions, because um, you told me, and I think that's something that the doctors have to do. It's talk about all the risks that can happen in the surgery, because there are risks, and you talk about it. And well, a lot of questions. What let me see, let me what happened if something go wrong? What happened if I there's a stroke? What happened if, I don't know, like, what happened if I don't have my functions 100% after the surgery? I'm gonna be the same, but because listen, Rick, my mom has this aneurysm thing, and she's the same, but there's some things of her personality that they're not exactly the same. You know, she can cry, and we talk about this. Like, I can cry. I don't know why. She can cry. She take things differently. Eh, s- Little changes in her personality, but I can see it, and I have to reinvent my relationship with her because she changed. So I was so scared that my personality change, you know, because, well, the only thing that I had, well, we only have our brains, okay? But I work with my personality. I'm a public person. So what if I change? How how can I communicate with my followers? How can I do my podcast? How can I do my conferences or my stand-up comedy? Because if something change, I won't do everything, nothing like I was doing it before. And I was so scared thinking about that.
So you go into the procedure super scared. They put you out, anesthesia. A couple hours later, you're in deep sleep. Tell us about the first things you saw, your first thoughts upon waking up, and what was your recovery like? This episode of The Brain Surgeon's Take is brought to you by Vitamin Water. Vitamin water is the ideal way to hydrate, replete your electrolytes, and maintain wellness. I drink vitamin water routinely during the day in order to keep up my energy and focus. Check out vitaminwater.com for more information and use the promo code BrainSurgeonsTake for 20% off your first order.
Well, the first thing that happened is when I opened my eyes, I saw all my relatives that were waiting. How long was the surgery? 6, 7 hours?
It was like 4 to 5, something like that.
Oh, okay. So they were all there, and I started to cry, Rick, and I didn't stop. I think, I don't know. I didn't stop crying. That's my feeling. That's my sensation. Like for 2 weeks, because I was so scared and so strong before the surgery that when I went out, and I was like conscious, like I think the same way I was thinking before the surgery. I don't know if I can move the same, but here I am. And I started to cry, and I couldn't stop because I was like, relief, relief. I'm the same one. And I started to cry. And of course, the things that people do after a surgery, that we started to joke. I was in high doses of anesthesia. I was, I have drugs for a long time in my body. But yes, I was relieved, and I when the drugs started to go away, like one day after, um, I think I was in this calm state of, I'm here, I'm okay. Let me take this very slow, because this was huge. I treated it like, okay, I'm going to surgery, and then the doctor told me that in 2 weeks I was okay. But I was like, your words for me were so important, Rick, because you told me that in 2 weeks I was gonna be okay. Like, in 2 weeks I can resume with my life and started to do everything as I was doing it before. And I was like, in 2 weeks, in 2 weeks, in 2 weeks. Of course, I was with the asteroids, I was swollen and I was very slow. I even can stand up, and but taking it slowly at my home. And I was like I have a lot of people around me, but I have a conversation with me, Rick, that it was very interesting. Like asking me things like, what's important in life, um, what would happen if everything like went bad. And I have really this conversation with me. People were around me asking me questions, and I was like, "What? Sorry, I can't keep it up." You know, like I'm talking to me, and I'm trying to see what this surgery brings me to a new perspective of life. I'm with my son, and I'm with my family, and I'm so grateful. And I started like a period of being so grateful with everything, with you, with the procedure, with God, with life, how life like unfolds and bring us like this new way of living. And to talk you about the first 2 weeks that I was like still with drugs, when I went and see you, um you were like, wow, you are incredible, you are awesome. And I was like, but you told me that I'm gonna be this way, but you were, Erica, I see you good, like you are so good, you're well, you're doing good. And I was like, you told me that I'm gonna be this way. So I'm telling you this because it's so important, the words the doctor say to you in your recovery, that they are like some kind of hope that you like. I Those words for me were very important for my recovery. And I think it was fast, um, but still I'm a little bit slow. I feel life is going too fast and I'm going a little bit slow. Comparing before the surgery. But I think it's something that I'm gonna be good like in the next month. I have only 3 months ago of the surgery. So yes, those words were very important, but then I understood that I have to go slow. That is not so fast.
I mean, your recovery has been amazing. Obviously, you're back working full time. You look great. You feel great. You sound great. So it's been an amazing recovery. Tell us a little bit about, and you mentioned it before, but I want to dive into it more, how the entire process changed you as a person, right? The tumor's out, it's benign, you should be cured, you're back to quote unquote normal. But how are you different as a person? Perspectives, priorities, how you get up every morning and face life?
Listen, Rick, I understood that there are a lot of things that were important that now they are not important. Discussions, decisions, I don't know, traveling, conversations, that they are not so important as I thought they were. So I have a new perspective. I'm still working on the conclusions because they aren't easy, Rick. They aren't like, um I'm thinking that there has to be something more, something more in life. Like I'm questioning like all this work and all this stress and everything that I do, that let's do this. Like for what? Let's see. In life there has to be another way of living. Like more, like we have, that's my conversation with me, that there has to be another way. There has to be more time doing things that you love to do, but you always postpone. There has to be other calm moments. Like we have to search for like sharing with your family, doing like nothing. Like there has to be another way, because this doesn't make any sense anymore. Like I still want to do what I do, of course, because I want to communicate, and I was born to communicate. But I I have another question. What is important in life? And that's my big question, and that's the question that I'm doing to my guests in my podcast. What is important in life for you and for you? We have different perspectives, and I want the answers.
It's
I
such an
want the
important
answers.
thing you said. It's like one event like this, and you quickly realize that the stuff that you worry about every single day, you really shouldn't worry about. And it's not that important. And I think we all get lost in that because that's just the world we live in. But it's good to kind of maintain perspective. This brought you back to perspective. And I try to maintain perspective every day, that don't sweat the small stuff, the stuff that happens
Hmm.
every day to everyone. Don't let that bring you down. And I want to talk about your family, your friends, because people think, oh, brain surgery, it's tough for the patient, which it is, obviously, emotionally, physically. Tell us how this experience changed your close circle of friends and family.
It was funny, Rick, because I was so strong, because I don't know, I didn't want n- that the people around me were they were scared. I don't want people scared around me,
Mhm.
afraid about this. I need people strong. I need people like as big as the situation. Like I'm here for you, without without being afraid. And my attitude, my way of approaching this, it was the same for everybody. Like I'm here with you, and I'm not crying, I'm not nervous. And it was incredible, and I'm very grateful with them, because they were all the same way. Even they were very scared, very very scared. They We talk about this later. And then it was important for me that they have the same attitude that I had before the surgery. And then there were for me, they didn't want to leave me alone at home, because, well, to see what happened to me. And they've been very patient, very very patient. They understood that the days after surgery, it wasn't me, that I was still with the painkillers, and I was a little bit off. And they were there for the important thing, that was to be with me, so I can feel that I was with people around me, with people taking care of me. I live alone with my son, that he is 15 years old. He, of course, he didn't know what brain surgery was about. He got very scared, and he didn't talk about it. He was very in silence. He was very scared, and you can see he was nervous, because the way he was acting and the way he was talking. And he was doing the best that he can, the best that he can. And when I tell you that I live alone with my son, I had people here like coming to my house to sleep with me. And you know what? Something that I learned, Rick, to ask for help, because sometimes we think that we can do everything alone, like we are empowered, and we are this kind of woman that we can do everything in life. Now nothing stopped me, not even a tumor. And I understood that nobody's gonna give you a prize because you're doing everything alone, and because you're strong, and like it's, you need to ask for help. And everything, and it's okay. We need each other. And that for me is a lesson that I learned in this process. Ask for help, be with me, come with me, like yeah. And it is okay. You are not losing your courage because you are asking for help. So I let people to take care. I let people to hug me and to love me, and I can show part of me, my vulnerability too. Like, it's not so important to demonstrate that you are strong. Yeah, you are, but you don't have to be in resistance all the time.
That's
So,
really well said. I mean, no one's invincible. And I think that showing your vulnerabilities, especially with family and friends, is only going to make the entire process easier. What would you say? And this is the final question because I know you're super busy, but f- most important piece of advice you would give our listeners who are going to undergo any major medical procedure?
Ricky, it's incredible because I when I posted about my surgery, I tag you and I talk about it like, hey, dear followers, this is what's going on in my life now, and I have brain surgery, I have this tumor, and I share what had happened to me. And somebody like told me, somebody that's very close, like, why do you do this? Don't talk about it. Like, go on with your life. Don't ask for mercy. I don't know, like, people don't have to see what happened in your life. Like, go your life, go, like, you don't have to talk about this. And I say, yes, I have to talk about it because this is life too. This happens to people, and we have issues in our health, and we have to talk about it. And then this the thing happened. I started to receive messages of people, women, that have many humans, and they didn't take care about them because they were scared, because they don't want to get surgery, because they don't want to visit again the doctor, because and this was like an awakening for a lot of people, and they started to call their neurologists and take care about their tumors. And there are people that call you, and you have done brain surgery to a few of them, and this is like all the reason of sharing my procedure is to help all other people, because if we don't use what happened to us to talk about it and to show it to the world, so this can make people take consciousness about their health, or the people that it's around that is having these health issues, there's no why,
Hmm.
there's no why and for what this happened to me. So this process, I share it from my vulnerability with all my followers, and this have an impact in some other people to take care about their health. So if you ask me for something that I can tell people that having these procedures, there are things that we can how do you say that, impedir. There are things that we
Things you can
can
control or
that
stop.
you can control, and there are things that you have to go through, and you have to do what you have to do to have the tools to go through the storm. And I call the people that I thought that can help me, really really help me. And i s- I started to do these practices like meditation, and to be with me, and to change my thoughts, because we are wired to have these apocalyptic thoughts, and I knew that there were only thoughts, and I started to manage them and to change them. Like, if I have two bad thoughts, I change it with two good thoughts. What is the best that can happen? That I'm going through this storm, I have a new perspective, and I'm gonna be okay. So I think, like, the best los mejores consejos that I can share is be around people that will be with you with good vibes, and talk to the people that you feel that they are very strong to stand with you and help you go through the storm. And trust your doctor and trust your God. And always think that everything's gonna be okay. And what is gonna happen, it's gonna happen for a reason.
Yeah, I mean, you have been an unbelievable patient from the very beginning, before the surgery, during the surgery, after the surgery. Like I said, I hope that our listeners listen to what you're saying about it's important to be educated as a patient. It's important to know what's being done, but too many questions only confuses a situation. You got to trust the doctor, trust the team, trust the procedure. A lot of that is just a gut feeling. You know, you can't really question it. And if you don't trust the doctor, definitely move on. Uh,
Yes,
and then surrounding yourself with family and love. I think that's something that you really focused on. And that's been a huge part of your recovery. On top of being an amazing person, your family and your friends really got you to where you are now. So, as I said,
absolutely.
you are my poster child when it comes to brain surgery. So, uh,
Yeah, and I have to say a last thing. Be nice with you after surgery. Be nice. Your brain just had a surgery, like I'm this process that, yes, I'm full working 100%, I'm traveling, but I'm trying to be nice with me, and like step by step. And I was somebody text me a message that had brain surgery, and this woman has like, I'm not feeling well, I'm sad, I don't know what's going on with me. She had surgery in December, not with you, with another doctor. And we are not used to be nice with us.
mhm.
So have patience, be nice, and trust the process. You have brain surgery, like, calm down, and everything, step by step, month by month, you're gonna have more concentration, and you're gonna think faster, and everything is gonna be all right.
Erica, you're amazing. Thank you so much for your time. And I have no doubt that we'll be talking soon. All right. Super proud of you.
Yes, thank you, Rick. Thank you
You're the
so
best.
much.
You're the
Thank
best.
you.
All right. Have a great day.
You too. Bye bye.